Doctors for Change started in around 2006. Actually, it started a few years before that when I and a few other physicians mostly working at Bentab Hospital, now called Harris Health, met around a kitchen table to talk about some of the frustrations and barriers to health care for our patients. That was Anna Malino, Dave Buck, Judy Levison, Nancy George, Claire Bocchini, and I. And we, on a day-to-day basis, experienced barriers for our patients in receiving excellent health care. And so we wanted to talk about how we could address some of those barriers in a systemic way.
So Doctors for Change is a nonprofit that's based here in Houston. It's primarily composed of physicians, but we have medical students, we have public health students, we have nurses, we have administrators, we have lawyers that are all trying to work on these unacceptable realities in health and healthcare that we face today in communities.
The unacceptable realities to me are, things that are largely outside of people's control that affect their health in a negative way.
As a pediatrician, I unfortunately do see children that struggle with obesity, and their families also struggle with how to help their kids out. They're doing their best to cook healthy meals, but at the end of the day, limited recess in school and kids' love of video games sometimes gets in the way of kids being healthy or living up to their full potential.
There are hundreds of thousands of victims of human trafficking just in Texas, much less the United States or the world, and people don't even know that it exists. I didn't know that human trafficking was a thing until I came to medical school, and I didn't realize how big of a problem it was until I got involved with Doctors for Change.
As we learn more about social determinants of health now, we know that the majority of what affects people's health are not things that we do as doctors in a doctor's office, but the places that people live, the environment that they live in, whether they have healthy food, kids having access to recess in schools, things that really promote health and do a lot more for that than, again, a lot of the things that we do in healthcare.
We see people on a day-to-day basis that are afraid to access care, afraid to apply for insurance like Medicaid because they're afraid of their immigration status. And to me, no one should be afraid to access care. It is an unacceptable reality that there are parts of our community that are afraid to seek care.
As a psychiatrist working with patients in my office, I saw repeatedly these issues that I felt pretty powerless to fix. And a lot of them, again, go outside of what we can do as physicians in healthcare, other healthcare clinicians. And so I feel like our advocacy work, we basically serve as a voice.